Hello everyone, welcome back to GrowMed. So in this video we will quickly discuss about some important clinical cases asked in the past years. So I have made those clinical cases easy by looking at the keywords so that it will help you in the exam and it will be time saving also. Okay, so without wasting much time, let's have a quick recall. Okay, and this will be a short video which you can watch anytime during your breaks. Okay, so first question is from the psychiatry, and so this is a mixed bag. We'll discuss some cases asked from each subject. Okay, so mixed bag questions. 19-year-old female, she has intense food cravings and eats large amount of food, but after eating food uses laxative and self-induced vomiting. See, these are the two keywords which you must see. First is the female, young female, so she's a teenager. She's worried about her body figure, so that's why she's like eating the food because she has cravings, but also uses self-induced vomiting she does, and her BMI is also less. So these are the keywords which you must look for. And now, what will be the diagnosis? It is the bulimia nervosa. Quite important topic and a repeat topic, and this asked in the NEET PGI and also in the Fmge exam. So bulimia nervosa. Okay, and another one disease similar to this is the anorexia nervosa. So have a look of the clinical features for those also. Okay, then the next question. So fever, confusion and hypotension is there. Heart rate is 120 and skin is warm, increase in the cardiac output, and it shows infection. So what kind of shock it is? So as we are dealing with the infection here and the skin and the peripheries are warm, that's why this type of shock is the septic shock. In the septic shock we can see these kind of features, and septic shock is mainly associated with the infections. Okay, so whenever there's infection in the body, the bacterial or viral, this will lead to vasodilation and the blood flow will increase to the periphery. So that's why warm skin will be there, and these are the features seen with it. Okay, so the next question, painless. Patient present with a painless soft mass on the back. Okay, and on examination the mass is well defined and mobile, and there is no history of any trauma or pain. So what will be the diagnosis? So whenever these kind of things are described in the clinical case, look for the lipoma in the options. If it is given, then the answer will be lipoma, because lipoma will be the cyst like a lesion due to the lipids. Okay, so fat filled lesions, and these will be mostly soft, and these will be having the well defined margins. So soft mass and well defined, so these two important things you must see, and as well as it is the mobile. Okay, so these features are describing about the lipoma. Then the next question, a female with the negative UPT, that is urine pregnancy test, is negative in her, and then she also complains of galactorrhea. On MRI you see a large pituitary tumor. So what treatment you will be giving? See, there is a pituitary tumor due to which the pituitary hormones are released in an increased amount, and the what prolactin is also released in the increased amount, and due to this prolactin you can see this negative what galactorrhea as well as this negative UPT. Okay, so the management of this will be to inhibit the prolactin, and the prolactin inhibitor are the dopamine agonist. So we need to prescribe the patient cabergoline drug, which is a dopamine agonist, and this will cause the inhibition of the prolactin and will lead to reduction of the symptoms. Okay, so this is about this test. So let me write it down here, dopamine agonist cabergoline. Then moving on to the next question. So a 12-year female with a history of sore throat, and 2 weeks ago, okay, so this they mentioned 2 weeks ago she had sore throat, and after that she presents with fever, joint pain, rash known as a erythema marginatum, and a murmur is also present. So what will be the diagnosis? See, I think this is a quite famous question, a rheumatic heart disease, and asked multiple times. So there are various things, the investigations, then the criteria, the Jones criteria modified, and the what major and the minor things. So you need to have a look at all those things from this acute rheumatic fever. Okay, so see, the things hinting us towards this acute rheumatic fever are the patient is young and they have sore throat, so there will be a history of sore throat in the acute rheumatic fever. Then involvement of the fever will be there, involvement of the joints, then the rash. This is a classical erythema marginatum seen with the rheumatic disease, and also there is a murmur present. Okay, so yes, clear cut diagnosis is that acute rheumatic fever. Then the next question, so a question from the micro, and let's discuss it. Fungal infection is there in a patient and pencil shaped microconidia is seen along with the red pigmentation. What will be the causative organism, or which fungus is causing these symptoms? So it is the trichophyton. Okay, so a kind of a dermatophyte, and this pencil shaped macroconidia is a classical feature seen with this. So whenever you see this thing, see, one liner question can also be asked that let me first write it down. Trichophyton. Yes, so one liner question can also be asked in this, that they'll just simply give that pencil shaped macroconidia is seen in which of the following dermatophytes, or they can give the image also of this pencil shaped. Okay, so these images have also been discussed in my YouTube channel with the name of mycology, so you can have a look at all the fungal infections there. So yes, this is the trichophyton. Then the next is a female with a PPH, postpartum hemorrhage. She was treated with oxytocin and ergotamine. And then no improvement is seen, still the bleeding is going on. So what next drug you will be giving to the patient? So we will be giving the prostaglandin, because this will cause the contraction of the uterus and it will stop the bleeding. Okay, so there's a protocol which we will be following in case of a PPH. So first of all, we will be giving the oxytocin, then along with that after that ergotamine, then after that prostaglandins. If still improvement is not seen, then we will be ligating the arteries. Then if still not done, then we will be doing the hysterectomy. So hysterectomy is the last step for the management of this PPH. If it is like very severe and the bleeding is not controlled, in that case we will be doing this one. Okay, so have a look at the protocol also. Then next question, solitary thyroid mass is seen and increased calcitonin is seen on examination. So what is the thyroid mass, or what is the diagnosis? So it is the medullary thyroid cancer. Medullary. See, because this calcitonin is a marker for the medullary thyroid carcinoma, and one liner is also asked in the past years that which of the following is a marker for the medullary thyroid, or they can ask this medullary thyroid which is the marker for the medullary thyroid carcinomas. Okay, so pattern of the question can be anything, so you must be prepared that let it come in any way, I will answer it. Okay, so that's why like this is the question, clinical case based question. Then next question from pediatrics. A 10-year-old child is pale, is malnourished, and reduced in the height for age, and the Z line score is less than -2 standard deviation. So what will be the diagnosis, or what is seen in the child? So it will be stunted. The child will be stunted because the height for the age is less. Okay. Then another question from the pediatric. 5-year-old complains of loose stools, severely dehydrated, hypotensive, lethargic, and tachypnea. What will be the management? So according to the IMNCI guidelines, this integrated management of the diarrhea and the dehydration, and this is very important classification, because in this classification it is classified into the 3 categories: the yellow, pink, and the green. So you need to read that in which category what falls and how you will manage it. So pink means the danger signs, and we will be giving this IV fluids and refer the patient to the higher center. And similarly, green in the sense we need to do the conservative management, and yellow means we need to look for the danger signs. Okay, so this is the protocol. Have a look at it, like expecting a question from this in the upcoming exam. So because this is a repeat topic and frequently every year one question from this is being asked. So IMNCI guidelines, so have a look at it. And in this question, the child is severely dehydrated, he is hypotensive, he is lethargic and tachypneic. See, the danger signs are present, so that's why we will be giving the child IV fluids, and normally we will be using the normal cell line. Okay, so these were some important clinical cases which were asked in the exam and which we have discussed. So stay tuned for more amazing things related to the FMGE. And as the exam is near now, you need to focus on the revision and look at the high yield points. So All the best to everyone giving this exam in the Chan, and I hope that you all will be passing with a very good marks. So thank you so much, guys. I am Dr. Padmini, your mentor for the FMGE. So you can follow me on the Telegram channel as well for more amazing stuff, and for the PDF as well, follow me on the Telegram. Thank you so much. Bye bye.